Hello everybody. In this month we have a paratesticular mass in a 17-year-old male, and this is another example for man at Istanbul of Ackermann. So here's the mass, composed of well-defined, and we may see some myxoid look on the cut surface, but we have a better picture for cut surface. Here, as you see, this tumor is composed of all myxoid areas. It looks homogeneous and some lobulations. Of note, we don't have any lipomatous areas, which may be suggestive of dedifferentiated liposarcoma. In the child, the paratesticular lesions, the most common tumor is rhabdomyosarcoma, whereas in the adulthood, mesotheliomas or dedifferentiated liposarcomas are seen. Under microscope, the tumor was composed of prominent vessels, and it has a myxoid background, as you all may appreciate. And the other interesting finding is the formation of these lakes, or to call the pulmonary edema-like structures. So when we have a closer view here, and another feature of this tumor is the vasculature. Again, here you see lots of vessels which resembles a chicken wire appearance. The other feature that is very important to reach the diagnosis, we don't see any pleomorphism. Okay, the cells are so bland. Let me show you in a higher power. As you see, we have these delicate vascular structures and some extravasated erythrocytes, and as you see, there are no pleomorphism or mitotic activity nor necrosis. Some areas are composed of the pulmonary edema appearance, and in some areas you may find some mature fat here and there, and all sections were similar, so the diagnosis is consistent with myxoid liposarcoma. But in this region, myxoid liposarcoma in this age population is a little bit outlier. So just to note that the liposarcoma, which liposarcoma is seen the most common in the childhood, the answer is myxoid liposarcoma. But to prove that this is myxoid liposarcoma, the only thing you should do is FISH, or to show the genetic rearrangements, which involves EWSR or FUS genes with DIDIT3, okay, DDIT3, which is also known as CHOP gene. So the other thing is immunohistochemistry is useless in this situation. I mean, this tumor is one of the best known examples of H&E diagnosis, because if you don't know this lesion by morphology, you have no chance to reach diagnosis by immunohistochemistry. So let me show you the FISH study. And as you see here, we have separated signals, which shows the DDIT3 gene rearrangement, which confirms the diagnosis of myxoid liposarcoma. Here is another tumor of another patient, representing the other end of this myxoid liposarcoma spectrum. So this is high-grade myxoid liposarcoma, aka round cell liposarcoma. So you may appreciate the presence of the prominent myxoid background and monotonous neoplastic cells. In this view, it may also resemble the embryonal rhabdomyosarcoma, but of course this tumor is Desmin negative, as being high-grade myxoid liposarcoma. And you should remember, or you should also consider the high-grade myxoid liposarcoma in the differential diagnosis of small round cell tumor. There is a very nice clue in this tumor here. If you see this low-grade myxoid liposarcoma area with very nice delicate vasculature, so the diagnosis is straightforward. Actually, you don't need any immunohistochemistry or any molecular stuff to diagnose this case. Thank you very much.